Do you often find yourself tossing and turning at night or waking up at odd hours? Do you spend your nights worrying about the day's events, feeling a sense of dread that keeps you from getting a good night's sleep? Maybe you've had panic attacks that are so intense they prevent you from working. Or perhaps the thought of social interaction is so daunting that it keeps you cooped up at home. Hey there, folks! Welcome to the Dark Psychology World channel. I'm sure many of you have heard of anxiety disorders. You might think of it as something that affects just one person who is constantly worried about all sorts of negative things happening to them, making them prone to fear and nervousness. Well, you're not wrong. But what we call an anxiety disorder is actually a broad term that encompasses many symptoms, including well-known conditions like social anxiety, obsessive-compulsive disorder, phobias, and panic attacks. So, in this video, we're going to delve into the world of anxiety disorders. We'll talk about the symptoms, what it means to have an anxiety disorder, and much more. If that sounds interesting, keep watching. And hey, if you enjoy this kind of content about psychology presented through animations, don't forget to hit that subscribe and like button. That way, you'll be notified whenever we have new videos. Alright, enough chit-chat. Let's get started. First off, it's important to understand that everyone experiences anxiety. But just because you feel anxious, it doesn't mean you have an anxiety disorder. Anxiety is a normal human reaction when we face stress. For instance, you might feel anxious when you're about to take an exam, move to a new place, meet new people, make important decisions, or experience an accident. These situations can make us feel nervous and scared, and we might even have physical reactions like a rapid heartbeat or sweating. These feelings of anxiety are all normal human reactions. It's also known as the fight or flight response. Back in the day, humans would often face attacks from wild animals. In these situations, the human body would automatically release hormones and increase adrenaline levels to make our blood circulate faster, allowing us to take more sensitive actions. It's kind of like getting a power-up. We'd either fight immediately or run away to increase our chances of survival. But once the danger has passed, the human body would return to its normal state and you'd no longer feel nervous or shaky. The same goes for the stress and pressure we face today. Once the situation is over, the tense feeling of pressure will also disappear. This is what we call anxiety. However, there used to be a group of sensitive people whose anxiety was prolonged and wouldn't naturally disappear. They might even feel anxious for no reason. This is what we call an anxiety disorder. There are many types of anxiety disorders, and naturally, they cause a variety of symptoms. Let's start by talking about these symptoms. Anxiety disorders can be broken down into 5 main categories: physiological, psychological, cognitive, action, and behavioral responses. 1. Physiological symptoms can include things like an unexplained rapid heartbeat, shortness of breath, sweating, muscle tension, trembling, dizziness, or stomach discomfort. 2. Psychological symptoms might involve feelings of nervousness, irritability, restlessness, worry, fear, or a quick temper. 3. Cognitive symptoms could be worrying that the worst will happen, feeling like others can see your anxiety, dwelling on past negative experiences, repeatedly thinking about past events, or feeling like the world is moving too fast or too slow. 4. Action symptoms often involve making jittery movements or feeling restless and stiff in your movements. 5. Behavioral response symptoms can manifest as becoming irritable, having an overly sensitive reaction, being unable to concentrate, or exhibiting avoidance behavior. Of course, it's important to note that not all these symptoms will appear at once, and the symptoms that do appear can vary depending on the type of anxiety. It's also worth noting that normal anxiety can also have the above symptoms. So, how do you tell the difference between normal anxiety and an anxiety disorder? There are 3 main factors to consider. 1. Intensity. Anxiety disorders involve a level of anxiety that's more intense and severe than what most people typically experience. 2. Duration. The symptoms of an anxiety disorder last a long time and tend to recur. Normal anxiety, on the other hand, tends to fade once the stressful situation has passed. 3. Rationality. Anxiety disorders often involve worrying about things that most people wouldn't find anxiety-inducing. Even though individuals with an anxiety disorder might realize their worries are irrational, they can't help but feel anxious. In simple terms, it's about the intensity, duration, and rationality of the anxiety. There are 6 common types of anxiety disorders: panic disorder, phobias, generalized anxiety disorder, GED, obsessive-compulsive disorder, OCD, social anxiety disorder, SAD, and post-traumatic stress disorder, PTSD. Let's start with generalized anxiety disorder, GED. This is what most people think of when they hear anxiety disorder. There's nothing wrong with that. GED is indeed an anxiety disorder. But to be more specific, it's called generalized anxiety disorder. People with GAD often experience excessive worry and anxiety about a variety of things, such as the health of themselves or their loved ones, their job performance, or everyday life events. These worries persist for several months and are accompanied by symptoms like restlessness, difficulty concentrating, fatigue, irritability, muscle tension, and insomnia. Some people might even experience anxiety about their anxiety, creating a second layer of distress. Next up is panic disorder, which is characterized by panic attacks. During a panic attack, individuals might suddenly feel extremely scared or distressed, usually for a few minutes. These attacks can be so intense that they cause physical symptoms like difficulty breathing, weakness or trembling in the limbs, chest pain, and fears of losing control, passing out, or dying. The timing of these panic attacks can vary greatly from person to person. The third category is phobias. Patients with phobias have a persistent and intense fear of certain things or situations. They know they're overreacting, but they can't control their fear. Common phobias include claustrophobia, trypophobia, fear of clowns, and acrophobia. The fourth is obsessive-compulsive disorder, OCD. Patients with OCD have uncontrollable obsessive thoughts and compulsive behaviors. We've explained this in detail in a previous video, so if you want to know more, feel free to check it out. The fifth is social anxiety disorder, SAD. This is a state of anxiety about social interaction. People with SAD are very concerned about how others see them and can't control their anxiety symptoms such as rapid heartbeat, shortness of breath, etc. This isn't caused by shyness or introversion. We've also discussed this in detail before. Post-traumatic stress disorder, PTSD, is another type of anxiety disorder. PTSD patients are those who have experienced major traumatic events and the specific fear that arises from these experiences. These fear reactions will appear from time to time, causing distress. Approximately 12% of the global population suffers from anxiety disorders. That is to say, on average, 1 in 10 people. And 5% to 30% of people have experienced anxiety at least once in their life. The incidence in women is about twice as high as in men. It usually starts before the age of 25. The most common type is fear of specific things. Nearly 12% of people at some point in their lives have had this problem before. Next is social anxiety disorder, accounting for 10%. There are many types of anxiety disorders, each with its own diagnostic criteria. It is generally believed that the umbrella term for these conditions is generalized anxiety disorder. Alright, let's dive into the diagnostic criteria for generalized anxiety disorder, GAD, according to the Diagnostic and Statistical Manual of Mental Disorders, DSM. There are 6 key points. 1. Excessive anxiety or worry about numerous events or activities. These concerns must have persisted for at least 6 months, with more days having symptoms than not. 2. These anxieties and worries are difficult to control. 3. These anxieties and worries must be accompanied by 3 or more of the following 6 symptoms: restlessness, feeling on edge, easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, and sleep disturbances such as insomnia or poor sleep quality. 4. These symptoms of anxiety, worry, or physical discomfort significantly interfere with daily life. 5. The symptoms are not due to substance use. 6. The symptoms cannot be better explained by another medical condition, such as panic disorder or phobia. If all 6 of these criteria are met, it's considered GAD. Of course, a professional diagnosis is always necessary. Now, let's talk about the causes of anxiety disorders. They're typically attributed to cognitive biases, physiological factors, and environmental factors. Cognitive biases refer to the tendency of individuals with anxiety disorders to take things too seriously. They might interpret neutral or positive events as signs of impending disaster or see things in black and white terms. This kind of thinking bias can easily lead to a state of anxiety. Physiological factors include genetic predispositions and an overactive autonomic nervous system, which controls the body's reflex reactions like heartbeat and blood pressure. Environmental factors can also contribute to anxiety disorders. Excessive life stress and growing up in a challenging family environment are both risk factors. It's important to note that anxiety disorders often don't exist in isolation. They may be accompanied by other conditions such as depression or personality disorders. Treatment for anxiety disorders typically involves 2 main approaches: medication and cognitive behavioral therapy. Medication often includes antidepressants and anti-anxiety drugs, which help to calm overactive parts of the brain and control excessive excitement. Cognitive behavioral therapy, CBT, helps patients explore whether their excessive worries are justified. It allows them to understand the root of their anxiety and emphasizes the importance of changing their thought patterns. As the old saying goes, 7 parts mental, 3 parts physical. This therapy can also be combined with muscle relaxation training and breathing adjustments. Proper muscle relaxation training is a very effective treatment method. Of course, it's always best to seek guidance from professionals for these treatments. In reality, everyone experiences anxiety, and anxiety disorders often result from years of accumulated stress and anxiety. It's a common issue in today's fast-paced world. But as long as you understand it and take appropriate preventative measures, you can manage it effectively. These measures might include finding supportive friends and family, expressing emotions through appropriate channels, maintaining good exercise habits, and ensuring adequate sleep. Understanding how anxiety develops is key. Prevention is always better than cure. And for those who have friends with anxiety disorders, offering your support and encouragement can make a world of difference. If you have any experiences to share, feel free to leave a comment below. And don't rush off just yet. Here are 2 more videos you might like. Give them a watch, and if you enjoyed this video, don't forget to hit the like button before you go. Share these fascinating insights with your friends and family, and hit the subscribe bell for notifications on new videos. This is the Dark Psychology World channel. Thanks for watching, and see you in the next video.